Hi there, Dr. David Weintritt, breast cancer surgeon. Let's talk for a moment about adjuvant therapy. So what is adjuvant therapy for breast cancer? So essentially that's defined as what treatments beyond surgery or in addition to surgery would be recommended for a patient to have a decreased risk of recurrence, meaning a better treatment of their cancer. Adjuvant therapy can be divided into two main categories. One is radiation. Radiation is a technique where a patient who's had surgery for breast cancer, typically women who've done what's called breast conservation, but in some cases also women who've had a mastectomy, would undergo a course of radiation, which is some version of radioactivity, usually a beam that would pass through the tissue, that is used to reduce the risk of their cancer coming back in the area where it was originally removed. Now, these treatments can go from anywhere from 5 days to up to 3 or 4 weeks. So there's a specialist that will have a conversation with patients about what radiation plan might be best for them. So adjuvant therapy can include radiation. The other very important part of adjuvant therapy would be medical treatment. So adjuvant medical therapy, like radiation, would be techniques beyond surgery to help reduce the risk of a patient's cancer recurring. Medical treatment for breast cancer is typically divided into two main areas. One would be called hormonal or endocrine therapy. Those are typically treatments that are prescribed where patients would take a medication by mouth, usually for a period of 5 years, but sometimes up to 10 years after their initial treatment for their cancer. And there will be specific indications in regards to analyzing and discussing the particular type of breast cancer someone has or had. The other version of adjuvant medical treatment would be chemotherapy. Now, chemotherapy is a very important decision because the treatment itself obviously has implications about something that can be fairly intense. Chemotherapy, like other adjuvant treatments, are based on an assessment of risk. It should be very clear and very important for patients to understand that while surgery is a viable and important part of a patient's cure or treatment of their cancer, surgery is focusing on local control. Chemotherapy and other versions of medical therapy are focusing on what we call distant control or risk of recurrence outside of the breast. Our ability to use sophisticated technology to determine what an individual's risk of recurrence would be are how we would make the determination of these plans. Suffice to say, there's a specialist called a medical oncologist that will help in making this decision, but it is important for patients who are engaging in consultations for a treatment for their breast cancer to be aware that not only a surgical plan, but an adjuvant medical plan and potentially a radiation plan need to be all done collaboratively to discuss and provide them the best possible outcome.